Many thanks for the opportunity to present our work on feasibility and inter-observer reliability of handheld Doppler audio interpretation in lower limb arterial disease. We present a multi-centre pilot study. I have no disclosures. The background of this is peripheral arterial disease carries a high global burden with over 200 million people affected globally. Handheld Doppler is widely used by the wider MDT at the point of care. However, audible waveform interpretation is subjective with variable training and expertise, and despite its widespread use, the interpretation of Doppler sounds varies significantly between clinicians. And before we can assess diagnostic accuracy, we first need to understand reliability. There are numerous studies assessing the interpretation of Doppler audio signals, and they're all saying the same thing, essentially, which is reliability is an issue. Therefore, we hypothesize that a simplified binary classification may well improve reproducibility. We therefore designed a multi-centre international cross-sectional pilot study involving 25 anonymised Doppler audio clips which were retrieved from our vascular lab from the popliteal and crural segments. We asked 50 raters from 39 centres, 6 countries, and numerous professions and grades who blindly rated each clip and labelled them as monophasic, biphasic or triphasic. There was no option to label them as unsure. No standardised teaching was provided, and raters, as I say, came from different grades and the different MDT groups. We then, during our analysis, created a binary model where we substituted biphasic and triphasic signals into a polyphasic signal group, creating a binary model of monophasic versus polyphasic. The tabulated results are shown here, which show that the accuracy across grades and profession, which increased in all groups with the binary model. The second table demonstrates the accuracy of responses depending on the signal, which again improved significantly in the biphasic and triphasic categories with the binary model. Here we have the graphs where we can visualize quite nicely the results, which clearly demonstrates the improvement across all grades and professions with the binary model, and obviously it's more significant in the biphasic and triphasic groups. We can therefore conclude that a handheld Doppler and audio interpretation is moderately reliable. It's most reliable to detect monophasic signals, and therefore its major limitation is detecting biphasic versus triphasic signals and the distinction of the two. Therefore, a binary model, which is monophasic versus polyphasic, is more reproducible and more clinically pragmatic. The results potentially suggest that in real-world practice, the value of Doppler audio may lie in identifying clearly abnormal, i.e. monophasic signals, rather than the fine waveform differentiation. This pilot study provides the basis for a phase 2 study which would be a larger multi-centre diagnostic accuracy study where we will also be analysing intra-rater variability to try and detect if clinicians differ rating the same signal at a different time.